Good evening. I'm Dr. Howard Hochster from the Yale Cancer Center, and I'm very pleased that you could join us this evening to talk about the diagnosis and treatment of early stage colon cancer. I just would like to say a few words and then we'll take questions, a number of which have already been submitted, and you can continue to submit questions as we go on this evening. Colon cancer, there are a couple points I'd like to make about the diagnosis and treatment of early colon cancer. First of all, the idea of screening colonoscopy is to prevent colon cancer. We believe that most colon cancer can be prevented if people have screening colonoscopy and polyps are removed before they become malignant. And that is because there are a number of orderly changes that happen from the time that normal lining cells of the colon go bad and all the steps that they have to undergo before they become cancer. And that can take a couple of years. So that is why we recommend screening colonoscopy for the general population at normal risk starting at age 50 and then every few years after that. If somebody is found to have colon cancer in the early stage, it is often cured by surgery alone, or sometimes surgery followed by some preventative chemotherapy. This is very similar to what many people are familiar with for breast cancer, where women frequently have a lumpectomy and then they have additional treatment. If the cancer is really down in the rectal area, further down in the pelvis, then radiation may be used as well. We decide on treatment for colon cancer based on the stage, and the stage can only be determined by pathology following surgical resection. So if you haven't had surgery yet and people tell you the stage, then it's usually an incomplete staging until we know for sure that what the pathology shows. So for early stage colon cancer, there are two factors that go into the staging. One is how far the cancer goes through the wall of the colon, and the second is how many lymph nodes are involved. So it doesn't matter how big it is, it doesn't matter if it's blocking or not, it's really how deep it goes into the wall or through the wall of the colon and the number of lymph nodes. And that will help determine whether it's stage 1, stage 2, or stage 3.